Just think of all the things you touch when you leave the house, when you go to, say, the supermarket, when you fill up your car with gas. Now, you might wonder, can I get infected with the coronavirus from just touching these surfaces? Well, the CDC and medical experts say the answer is yes. But how often is the virus, the one that causes COVID-19, actually found on these high-touch surfaces? Well, the I-Team's Joel Grover used state-of-the-art technology to find out.
Hundreds of hands touch these shopping carts every day, and these elevator buttons, and these gas pumps.
Just swab the cart.
To find out if they're contaminated with the virus that causes COVID-19, the I-Team went from Brentwood to Bellflower,
Doing a handle of the men's room at the grocery store.
from Southgate to Signal Hill.
This is the bulk food section.
Swabbing 75 surfaces across LA County, including weights at the gym,
This is the self-checkout.
screens at big box stores, crosswalk buttons, even one of these popular electric scooters. We're using a COVID-19 swab test made by San Francisco-based Philogen, designed to help schools, offices, and businesses identify surface contamination.
You can use that information to increase safety protocols, like making sure that people are wearing masks before they come indoors.
At this busy gym in Lakewood, currently defying state and county orders to close, all of the surfaces we swabbed came back clean. So did the store self-checkouts and even that scooter. But at this Food for Less in Arleta, we found the virus that causes COVID-19 on multiple surfaces.
I'm doing a shopping cart.
Like this shopping cart, on this bread case,
The bakery section.
and this handle in the frozen food section.
The ice cream freezer.
At this Bank of America in Bellflower,
Swab the keys at this ATM.
we found the virus on this keypad. And at LAX in Terminal 4,
I'm going to swab the escalator.
this test was positive for the virus. We found it on doors at public restrooms, including a door at this Walgreens in Huntington Park, and at this Home Depot in Signal Hill, where the health department documented a recent outbreak of COVID-19 infecting 11 employees. We found it in the men's room on a handle of a stall.
It's not surprising that you found virus.
We shared our results with Dr. Neha Nanda of USC's School of Medicine and with Dr. Tim Brewer of UCLA's School of Public Health.
It can survive for up to 72 hours, particularly on plastic and steel.
The test doesn't specify if the virus was alive and infectious at the time we swabbed, but the company says it likely was recently. If a person touches one of these contaminated surfaces, how would they get infected?
So they touch that surface and then they reach up, oh, I've got an itch or something like that. They touch their mouth or nose.
Of the 75 surfaces we swabbed, 11 of them, almost 15%, had the presence of the virus that causes COVID-19. All of them were inside or in the shade. Experts believe sunlight actually kills the virus within minutes. Experts say there are things you can do to protect yourself. When you're touching a public surface, disinfect it first with a wipe, and then sanitize your hands when you're done. We saw a lot of people wearing gloves out in public, but Dr. Nanda at USC does not recommend that.
Just because wearing gloves really plays with our psyche of getting a false sense of security and can result in cross-contamination.
Some of the businesses where we found evidence of the virus, Home Depot, Food for Less, LAX, and Walgreens, tell the I-Team they do frequent cleaning and disinfecting of high-touch areas. They follow CDC guidelines and have taken other safety measures. But the experts we spoke with say our swabbing tests reveal businesses should consider sanitizing surfaces even more frequently. For the I-Team, I'm Joel Grover.